You may even react to somebody spontaneously. You're reacting to somebody spontaneously just because of these hormones reacting in your system without you knowing. So I do pray that as men, we can understand with our ladies and always see how to maybe turn down whenever we feel that they may have gone wrong, and try to talk with them in a better way, talk to them in a better tone, because the life of a woman is full with a lot of ups and downs just because of her own nature. That is how God has created them. So we need to understand them like that. Hey, Sister Rosa, welcome. Thank you very much for joining. So by the time you grow up and you start thinking of having a baby, start thinking of starting a family, there will be this name that will come out, that is ovulation. Ovulation. If you're thinking about pregnancy, you will think about ovulation. The ovulation is when your egg is being released from the fallopian, from the ovaries, and comes down to the fallopian tube for fertilization to occur. And this happens within a particular period in your menstrual cycle. So the ovulation day occurs probably a day within your menstrual cycle. If your 28-day cycle occurs on the 14th, if your 30-day cycle occurs on the 16th, on the 18th, if you're on the 16th, sorry, if your 32-day cycle it occurs on the 18th, if your 35-day cycle it occurs on the 21st, if your 21-day cycle occurs on the 7th. So depending on your menstrual cycle, your ovulation day will occur on a day that is probably different from maybe your sister's own, maybe your husband's wife, your brother's wife's own, or maybe a friend's own. So we should not always think that the ovulation will be the same, because there are some people who will think that the ovulation is the same because your sister maybe ovulated on the 15th. You think that, oh, you should also ovulate on the 16th. Yeah, sister. The rice effect. Yeah, that's right. That's right. Menstruation as a whole is a big issue. So a lot of ladies really go through a lot of challenges just because of this. So during this ovulation time, you may have a lot of different scenario. Your ovulation may occur on the 7th if you're 21-day cycle, and you'll be thinking, oh, come on, make my sister's ovulation should occur on the 7th. It is not like that. The ovulation depends on the length of your cycle. Remember, we have the shortest cycle being 21 days and the longest cycle being 35 days. Where we have cycles longer than that, but generally it's 21 to 35 days. So depending on the length of your cycle, that is how your ovulation will come. For ladies trying to conceive, if you have been trying to conceive and it is not going, please make sure that you can understand your ovulation. And we'll be giving some symptoms of ovulation here. Despite what we are going to give you as symptoms of ovulation, you make sure you try and follow through your own system and understand exactly what is going wrong. Because by understanding exactly what your system is, you can easily know that, hey, come on, my ovulation is coming on this day. Then even you reading on the internet. Okay, so what we are going to give you may be something general, but specifically, you should have something that you can hold it. Okay. Hey, Sister Mariam, welcome. Thank you so much for joining. So this ovulation occurs once in a cycle. The ovulation occurs when the egg is being released from the ovaries and it comes down to the fallopian tube for fertilization. And if fertilization does not occur, what happens is that egg is going to be breaking down. You see the walls of the womb will break down this egg. It breaks down plus the egg, and you now have it as menstruation. Isn't that beautiful? That is why generally we say that someone cannot be pregnant and at the same time you menstruate. Once you are pregnant, you don't menstruate. It is true that when you are pregnant, some ladies, when they are pregnant, they actually, it's true that some women, when they are pregnant, they actually have some sort of spotting. If you have spotting when you are pregnant, please, if you have even bleeding, that it comes like menstruation, please, it is not menstruation. After pregnancy, we don't have menstruation anymore. Okay, once you're pregnant, you can have bleeding, but you can't have menstruation. That should be clear. So we should take note about this and always understand it. If you have a lady, if you have a friend, if you have a neighbor who says that, hey, come on and menstruate when I'm pregnant, please, it's good to correct the person, because once you're pregnant, you don't menstruate. You don't menstruate. The reason is we don't have any egg that will be released once you're pregnant. Once you're pregnant, there is no egg that's released again. Okay, you don't have any egg that's been released once you're pregnant, because that egg that has been broken down, that has been fertilized, and signals are being sent to other hormones. Signals are being sent to the follicle stimulating hormone not to stimulate production of any egg again. So at that time, you see follicle stimulating hormone breaking down. That's going the level of follicle stimulating hormone, which is responsible for stimulation of your egg. That hormone actually drops down when you're pregnant, and you have the progesterone hormone that comes up. This is really beautiful. So you have the follicle stimulating hormone, it goes down, progesterone comes up. The reason for progesterone coming up is because progesterone works mainly to actually protect this child. So progesterone comes to protect the baby by building the thick walls. You see, the endometrium now become thick just because they want to protect the child. And at that child, because in the first 1 month, 2 months of that baby, once you are pregnant, that first 2 months are very crucial. That is when we have a lot of miscarriages. So progesterone comes in now to help and protect this baby. That's the work of progesterone. So you see that you have a whole lot of issues happening for a woman when you ovulate. If you ovulate and eventually becomes pregnancy, the pregnancy has to develop now. You have implantation, the pregnancy now grows right up to 9 months. And if there is no pregnancy, you bleed and you have menstruation.